evidence matter?
I think
and perhaps even more relevant, how do we make evidence matter? So I think this is going to be an exciting discussion. You know, the stakes today about evidence is extremely high. In South Asia alone, because of the pandemic, close to about 80 million people are going to be pushed into poverty. So the evidence of how to reverse the pandemic, how to address the challenge of the pandemic is going to be very, very important. So this issue of monitoring and evaluation is an extremely important issue, and more so in today's world. We're going to start off with a video that highlights the importance of M&E, as we call it, in confronting the current crisis in South Asia. So I'm going to invite all of us to watch the video, and then I'll be back with you.
Hello, my name is Shanti. In this video, I will discuss why evaluation and monitoring are key in confronting COVID-19 and building back better towards the 2030 agenda. COVID-19 threatens to push between 88 and 115 million people around the globe into extreme poverty. The pandemic has taken a heavy toll on people and economies as governments make tough decisions to stop the spread of the disease. Poorer and more vulnerable segments of the population have been hit the hardest as they are least equipped to cope with the health and economic impacts of the pandemic. In South Asia alone, the number of new people driven into extreme poverty will likely be between 78 million and 82 million. In these unprecedented circumstances, governments need robust systems for gathering and analyzing data and the knowledge and expertise to translate the results into effective policies and actions. They need the capacity to track the progress of their policies, ensure that no one is being left behind, and to change course should the evidence warrant it. Effective monitoring and evaluation systems are a key element of the pandemic response. They help countries learn about what is working and for whom, what needs to be adjusted, and to use this evidence to design more effective policies for coping with the current crises and to be better prepared for the next one. Countries need urgent, coordinated, and sustained support for building their M&E systems and capacities. If you want to address the current crisis and be prepared for the future crises, we need to close the gaps in monitoring and evaluation capacities now.
Welcome back. Thank you very much for watching the video. I'm told that when I try to introduce myself, I may have been muted, so let me try again. My name is Junaid Ahmed. I'm the Country Director for India for the World Bank. It's a pleasure to be here with you. Thank you very much to all of you for joining us, and thank you very much for participating in our poll. I'm not sure whether the poll is over or not, but I hope you've been able to give your perspective. I will convey the results of the poll as soon as I have it, but let me just say that at the bottom of your screen there's a small icon that says Q&A. So please click on that to open the window for Q&A, because that's where we'd like you to leave your questions and comments. And we will aim to answer as many of the questions that we are able to. We have a very exciting show today. We're going to first focus on the Global Evaluation Initiative, which is a new partnership that was launched in November last year. And it proposes a new way, if you will, of working at a global scale on building up monitoring and evaluation capacities worldwide. So we will talk about that. Then we will be absolutely, I think, challenged by the Nobel laureate, Dr. Abhijit Banerjee, who has kindly agreed to provide the keynote remarks on the importance of evidence-informed policymaking in South Asia. And we have, following that, gathered a very distinguished panel of speakers from government, from independent evaluators, civil society, from South Asia, to discuss the state of the region's monitoring and evaluation capacities and what it'll take to close the M&E gap in South Asia. And as I said, I think the questions are very clear to us. Does evidence matter? When does evidence matter? And in fact, what must we do to make evidence matter in policy making? So I hope that our colleagues who are going to join us will certainly keep us challenged. I see that I've just gotten the poll results, so let me share that with you. The poll results suggest that 40% of you think enabling environment is probably the biggest challenge that has to be overcome to make monitoring and evaluation work. 19% of you think more dedicated resource, 32% of you think access to knowledge and training, and 6% of you think it's global support that's needed. But clearly 40% think that it's the enabling environment. So we will see what our speakers, the keynote speaker, Abhijit, and what our panelists will say from their perspective. But first, let's begin with a discussion about the Global Evaluation Initiative, which I said to you is a new framework that is being introduced and what it might mean for South Asia. So I'm very pleased to welcome Alison Evans, the Director General of the World Bank's Group's Independent Evaluation Group, and Oscar Garcia, the Director of UNDP's Independent Evaluation Office. Two wonderful people to join us to start off this discussion about the Global Evaluation Initiative. So let me first turn to Alison, who is the IEG Director General. Alison, why the Global Evaluation Initiative, and importantly, why is it relevant for this region? Over to you, Alison.
Thank you very much, Junaid, and thank you very much for moderating this event today. Much appreciated. I'm also delighted to see such a distinguished set of speakers with us today, and also want to note the honour and significance of having Professor Banerjee join us as part of the programme. As a Nobel Prize winner with Professors Duflo and Kramer in the field of evidence-informed development, I can't think of a more appropriate speaker to kick us off. I'm also delighted to be here with my colleague and core partner in GEI, Oscar Garcia of the Independent Evaluation Office of the UNDP. So, to your question. The video that opened the event described a gap in monitoring and evaluation capacity in South Asia. This is a regional gap, but it is also a global gap. How do we know this? Well, according to a report from the Global Partnership for Effective Development Cooperation, more than half of all countries around the world now have high-quality national development strategies, with the majority of those aligned with the Sustainable Development Goals. But the capacities needed to turn these policy aspirations into actions have not developed at the same pace. The same report tells us that only 1/3 of all governments currently have the necessary data and systems to track the implementation of their national strategies. This is the global gap in monitoring and evaluation capacity. So why are we so concerned? Well, this gap means that a large number of countries are at a major disadvantage in generating the necessary evidence to understand the efficacy of their policies and programs for achieving the global goals and to course correct as necessary. The gap is at risk of becoming even more of a problem as countries face the combined threats from the COVID pandemic, from climate and environmental stress, and rising inequalities. Now, closing the global gap in M&E capacity is a huge challenge, and it will require sustained and coordinated action from multiple actors to tackle it. We know that countries are committed to building up their M&E capacities, but we also know that the demand for support well outstrips the resources of any single institution to respond. So this is the motivation for the Global Evaluation Initiative, to provide a platform where diverse actors interested in tackling this challenge can come together to coordinate and scale their efforts in building monitoring and evaluation capacity in as many countries as possible. And as a result of those combined efforts, contribute to the evidence needed to tackle development challenges and make better public policy decisions. Now, our partners in South Asia have seen increasing demand from national and local governments for training their staff in M&E. For instance, in 2019, our Centre for Learning, Evaluations and Results for South Asia entered into a long-term partnership with India's Department of Personnel and Training to create an online course on using data and evidence for decision-making. Since that course was launched, 155 civil servants have signed up, and the collaboration has demonstrated an appetite for online learning among public officials to develop these key skills. And we've seen this same appetite not only in India, but elsewhere in South Asia and in other regions of the world. GEI seeks to match this appetite with a supply of services and knowledge products drawn from all levels that support the development of country-led and country-owned monitoring and evaluation systems. GEI partners already have many effective programs in operations in this space. By enhancing coordination between them, learning and knowledge sharing, the GEI aims to increase both their scale and their impact. So I started by noting the shortfalls in M&E capacity around the world. And this is what motivates the GEI, and GEI is a bold first step to try and tackle that gap. But we cannot do it alone, and we need many actors to join hands together on this agenda if we're going to successfully tackle the scale of the monitoring and evaluation gap. Back to you, Junaid.
Alison, thank you. I think that really starts us all very well on this question that we will look at today, the role of monitoring and evaluation and how to build the capacity amongst policymakers and others. Oscar, thank you for joining us. A lot of attention is on the pandemic and trying to get evidence as we go forward to deal with the pandemic. But if we take a slightly medium-term look, how do you position monitoring and evaluation in the policy-making world, especially in the context of SDG and dealing with SDG?
Yes, good evening, Junaid, and thank you very much for hosting this. Greetings from snowy New York. Indeed, policymakers around the world are focused on the immediate challenges of the pandemic. This pandemic has turned our world upside down, unleashing a huge human development crisis. As a result, there has been a reprioritization of national development goals. It is obvious, but amongst these top priority goals is health now. Strengthening the health system. Also, restoring livelihoods is also critical. Ensuring youth empowerment and employment is particularly crucial to maintain and strengthen the social contracts around the societies in the globe. If not, we may see other priorities arising in the areas of governance and probably security. This does not mean that the Sustainable Development Goals, or SDGs as we know them, are no longer relevant. On the contrary, the crisis has shown us how deeply connected we are to each other and to the planet. The COVID-19 is forcing us to revisit our values and challenging us to design a new era of development, one that truly balances economic, social, and environmental progress as envisioned by the 2030 Agenda for Sustainable Development. In short, the pandemic presents an enormous challenge, but paradoxically, it also offers tremendous opportunities for reaching these goals. We have moved into a new era with many challenges, but one that requires us to reiterate our commitment to foster a more inclusive and sustainable development pathway. And this is where investing in M&E is key. We need bold and effective policy actions to guide development in the right direction. We need to be sure that we are investing our limited resources wisely. And to do this, policymakers need evidence from monitoring data and evaluation to tell them as quickly as possible which policies are working, where, and for whom. We need evaluation to show us if and why vulnerable groups are being left behind, if policies are not having the intended effects, or if programs are not reaching those with the greatest needs. We need to understand why and correct the course. Therefore, monitoring and evaluation are critical to getting back on track and rebuilding back better. This is why in the United Nations Development Program, UNDP, and its independent evaluation office, we are committed to the Global Evaluation Initiative and to strengthening engagement with national governments and other evaluation stakeholders to further support the development of national evaluation capacities and systems. We need monitoring and evaluation to meet immediate challenges and put us on track to a more sustainable development pathway. Let me stop there.
Oscar, thank you very much. Oscar, I'm going to ask you another question and then pivot back to Alison. So, Oscar, I look at the US and their response to pandemic, and what worries me is I'm not sure that some of the key policymakers are using evidence to actually make decisions about the pandemic. And I use that as an example, but I've seen here in South Asia the same. So the question to you, based on your experience, what needs to be done to put evidence and monitoring central to policymaking decisions? Or do you feel that my nervousness about this is not on target?
Thank you, Junai. This is an excellent question and an excellent case in point about the importance of evidence. But we need to understand this as a system, as an open system. Therefore, it's not just the will of one person. It is really the ability to create institutions that provide the required checks and balances for using evidence. And that's why with the GEI, we intend to support our countries, understanding that each country has a different institutional architecture, different history, different culture, and we need to understand that in order to really strengthen a system that allows evidence to be at the forefront of policy making. And as you have seen, here in the US, it was a perfect example in which the use of face masks became ideological instead of evidence-based of what science is telling you about how to try to prevent the spread of the virus. Therefore, that's exactly what we want to say when we say it's very important to strengthen these abilities to base policy making on evidence.
Fair enough, Oscar. So Alison, Oscar's point that we want to embed monitoring and evaluation into systems, into national systems. So if I go back to the GEI, can you share with us a little bit how you see GEI helping countries actually strengthen their systems? What type of services would GEI provide?
Great, thank you, Junaid, and fully concur with Oscar's response to your last question. GEI really is built around the concept of supporting sort of three levels of engagement. And the first level is precisely that enabling environment that came up so strongly in the poll at the beginning of this session, which is to create the conditions within which evaluation and monitoring can flourish, can be recognized, can be encouraged to support sound policymaking. And then there are two other levels. The other level at the level of institutions and what might be needed to strengthen specific institutions and their engagement with and commissioning of evaluation evidence. And thirdly, at the level of individuals, of individual skills. So the Global Evaluation Initiative will offer a range of services covering diagnostic work, technical advice and support, training and knowledge sharing, all aimed at developing effective national and institutional monitoring and evaluation frameworks embedded within functional evaluation systems. Many of these services are actually already part of ongoing capacity development programs, which GEI will draw on and amplify. In that sense, GEI is not starting from scratch. Rather, the idea is to be a catalyst and a coordinator of services currently being offered in standalone programs, many of them fragmented, if you like, programs, and to identify ways to bring them together, to scale their efforts and to enhance their impact at the country level. So just in this example, through the collaboration I mentioned earlier, public officials across India now have access to the Abdul Latif Jamil Poverty Action Lab, JPAL, and MIT's online MicroMasters program in data economics and development policy. Our local partner in Pakistan, the Center for Economic Research in Pakistan, conducts regular workshops on evidence-based program design with the aim of identifying mechanisms to maximize the impact of development policies and programs and to expand the scope of M&E methods in Pakistan. And I'm really pleased to see government evaluators from India and Pakistan on the panel and look forward to hearing their views on the progress made to date and the work ahead. But another critical service of the GEI will be to act as a platform for generating and sharing M&E knowledge at a global and a local level. And here too, we have initiatives to build on. The Independent Evaluation Office of the UNDP, for instance, hosts a biannual National Evaluation Capacities Conference that brings together officials engaged in evaluation from around the world and provides an important forum for sharing knowledge and supporting peer-to-peer learning. 2 years ago, IEG, along with the CLEAR initiative, launched the Global Evaluation Week as a tool for knowledge sharing. So far, local partners have hosted over 500 M&E events in over 5 continents in multiple languages. And in South Asia in 2019, there was something like 26 webinars organized by our partners in Afghanistan, India, Myanmar, Pakistan, and the Philippines on different aspects of the monitoring and evaluation challenge. So GEI will look to enhance these ongoing efforts and really to combine them in order to scale the impact principally at the country level. On the knowledge front, we're particularly pleased to be collaborating with Better Evaluation on the creation of a publicly accessible online knowledge repository to support mutual learning. And this will be available soon. Looking ahead to the next few years, it's clear that advances in systematic monitoring and rigorous evaluation will be needed to contribute effectively to the goal of building back better, or maybe building forward better. Through its broad and inclusive partnership, the Global Evaluation Initiative launches with a global presence, a deep reserve of monitoring and evaluation knowledge, and extensive experience in training and capacity development across many of its regions. This is what GEI brings to the challenge of closing the M&E gap. And we look forward to working with as many of you as possible to make that happen. Back to you, Junaid.
Thank you very much. That's a very ambitious set of goals that you have established, and we certainly in India would be very much interested in a partnership to take this forward. Alison and Oscar, thank you very much. I hope you can stay with us to maybe answer some of the questions from the panelists and the audience. Let me now welcome Nobel laureate Dr. Abhijit Banerjee, who all of you know, and he's the Ford Foundation International Professor of Economics at MIT, and is the co-founder, along with Esther Duflo and Sendhil Mullainathan, of the JPAL. Abhijit, it's wonderful to see you. You know, Abhijit, I always wonder, I had the good fortune of being in the same micro and macro courses with Abhijit at Harvard, but he sat in the front, I sat in the back. And I wonder if that's what made the difference. Abhijit, as always, great to see you, and we look forward to your perspectives. Over to you.
sit in the front
Abhijit,
as a matter of
there we go.
principle. But there is I think it's a moment for congratulation. I think it's really timely, and it's great that the World Bank and the UNDP have come together to put this together. It was long overdue. In a sense, we're in a place where I think the pandemic did an excellent job of kind of heightening issues that I guess many of you were aware of, and many of us were aware of, that there are very important gaps in data and in being responsive to events like the pandemic, but also to more long-term challenges. And in some sense, I think the pandemic did sort of, in a sense, highlight that in a rather dramatic way. I think one of the I'll give you 3 examples. One is simply the fact that when the pandemic hit, and for example, the Indian government announced a lockdown, there was, I think rightly, and I was included in those people, saying, well, now we have to do something about the people who are stranded in the cities. People who have no more access to their local social support, which was assigned to their home region, and they were living in a city where they had no social support. The problem was nobody knows how many people there are. It's a stunning fact, actually. We don't know how many people there are. We don't know where they live. We don't know how they live. This is not impact evaluation. This is prior to impact evaluation. This is a fact which we if we don't know it, we cannot possibly help them, because they don't, in a sense, for the system, they don't exist. They're living in their village, but they're not. And there must have been 20 million people like that or more. We have no idea, but something of that order of magnitude, and we were just missing that. That's the population of many medium-sized countries. We were missing. Another example that I think is striking world over is we are planning now to vaccinate people. We are deciding where to vaccinate people, what rate to vaccinate people. There are very few countries which have a countrywide serosurvey of where the infected populations, already infected populations, are concentrated, and these are people who should have lower priority. And in the meanwhile, we see that in a lot of countries, including in India, and for a while in all over South Asia, the infection rates have been going down. Is that a result of the fact that many people are already have it in these clusters, and therefore, but is it the case that therefore we should focus not on Delhi, where a lot of people clearly have had COVID, but in rural Bihar? What this implies for our strategy of vaccinating people is not even a question we can ask, because we just don't have the data. We won't have the data. We're sort of given up on that. We're sort of going down some other priority order, which seems, I think the healthcare workers are a good target, but there are others in that list who may or may not be. But mostly, we haven't really, the data question hasn't even entered that conversation. The same is true by the way, in France, where I am right now, they don't have a serosurvey. So they did a serosurvey in three cities. Turned out those were the hotspots of COVID, so they learned nothing, because those were the places where everybody knew there was a lot of COVID. But in any case, I think this is the problem in the US. It's really amazing that so many countries have functioned without, the core data that you need. Finally, let me an issue that as someone, I'll confess to my own failure. As someone who been working on how to get people to vaccinate for 20 years. I realized, somebody asked me the other day, what do you think is the key issue with the strategy for vaccinating people with these new vaccines? And I said, well, there are 2 vaccines. You have to take 2 shots. How do you get people to understand that they need to take the second shot? We have done as for in JPAL, I think we worked a fair amount on vaccination. I worked a fair amount on vaccination. We've never addressed this issue. Sort of, there is a sense in which how we get people to think about the connection between vaccines, the what vaccines do and don't do, how to get people to have an understanding of vaccines. That's a question we have not addressed. So it's sort of, I think, and that's an impact evaluation question. I think all of these are places where evidence could change the way we would function in very, very significant ways. And we haven't gotten there. I think that's not exceptional. That's often the rule. On the other hand, I feel that this is a great moment to do this because I do think that the resources are now there. There's just a effulgence of evaluations from all over. The World Bank has been, of course, a leader in this, and UNDP and our work in JPAL, but there's tons of other work as well. And bringing it all together, bringing together the underlying learning through these online courses that Alison, our courses, for example, Alison was kind enough to mention. So all of those the resources are there. In some sense, I think we are now in a place where if we tried to do it, we could do it with fairly little additional resources other than clear thinking and systematic. I mean, I always say that, when people say, how much will an impact evaluation cost? It'll cost $500 million. And then people say, isn't that a lot? And the answer is, then we'll allocate $1 billion based on that somewhere. And nonetheless, it's always the $500 million that's a sticking point. So I really think that it's a small amount of resources, lots of coordination, lots of forward thinking about where the evidence is needed, and we could really have a transformed world. So on that note of hope, let me congratulate you, all of you again, and say goodbye. Thank you.
Abhijit, thank you very much. Would you have time for a question, or
I have to be in another meeting at 2.
No,
it's past 2.
Not an issue, Abhijit. Be well,
really
be
sorry.
safe, and thank you for joining us.
Thank you. Thank you very much.
Thank you. Wonderful. I think those were very powerful stories if we had the evidence. And I think the challenge to all of us is it seems that the resources are there to go get the evidence. Question is, why aren't governments reaching out for those evidence? And I think Oscar turned around and said we have to move it out of the hands of individuals, embed it into systems. And Alison's point that that's exactly why our global initiative is out there, is to try and help build such systems. So I think we're beginning to get at a storyline that it's not just simply technocracy that's missing. There's a whole political economy around evaluations that is very, very important. I'm delighted to now introduce you to a wonderful panel that we have, and I'll introduce you as I ask our panelists the question. Let me start first by asking Dr. Shekhar Bonu, who's the Director General of Development Monitoring and Evaluation Office of Government of India, to maybe share a few of his thoughts. Dr. Bonu, you're in middle of Government of India. You're in Niti Aayog, a very important institution. My question to you is, what does it take to make monitoring and evaluation part of a government system that constantly uses that to decide on policy? What lessons are you learning from your work, and in particular, what lessons are you learning in the current pandemic situation on the use of M&E in governments? Dr. Bonu?
Thanks, Junaid. Good morning to all colleagues who are joining from Americas, and good evening to all the colleagues who are joining from South Asia. I also would like to join in congratulating the IEG of World Bank and UNDP on the launch of Global Evaluation Initiative. Congratulations, and we from DMO and Niti Aayog look forward to collaborating. As you know, we actually are beneficiary of the CLEAR initiative, where through CLEAR, through JPAL, we have had ongoing collaboration. And not only that, but we have also extensively benefited through collaboration with the World Food Programme. We are working on food and nutrition security related issues. With UNICEF, we have had long collaboration. One of the success stories is we managed to get Carnival's Gonzalo to come and talk to not only Government of India, but also with a few state governments. And of course, with Junaid, we are extremely happy to collaborate on trying to work on building strong systems which can enable monitoring. Ultimately, you need strong systems, data architecture. The whole building blocks are essential to collect the right type of data, to do better monitoring and better policy from the data that comes in. And one of those critical initiatives for very fragmented social protection context is having a strong social registry. And we are very glad to be working with Junaid to do it. And likewise, we are working with BMGF to build the curriculum, core curriculum based on functions, activities, and competencies. And I think that is one of the critical dimensions for a global scale partnership. Ultimately, with IT and so many other things coming in, it's a multidisciplinary effort which needs a huge amount of different type of skill set. It's not just about resources. You need to be very good at procurement, getting the resources to come in, then also work with the people who are very good on data. So I think building this very strong competency frameworks and teaching learning material and using MOOC to scale, I think would be extremely important challenge. Coming back, Junaid, to your question, ultimately all governments and all political leaders want the programs to succeed. There's an inbuilt incentive, especially in a democratic system, where there is huge amount of media scrutiny. So, but clearly, monitoring is, it needs a lot of building blocks to succeed. And I think India had made significant progress in, Aadhaar and public distribution system. We can further build other things, other dimensions to it, other aspects to building a stronger monitoring evaluation ecosystem. Definitely, there's a lot of interest. Since last 2 years, I find many ministries, departments very keen to learn from monitoring and evaluation. Definitely, there's a long way to go. Many times we don't have baseline data, so that impact evaluations and others are very difficult. But by using qualitative, quantitative, and triangulation, I think we can get better insights. I'll stop here and maybe respond later. Thank you, Junaid.
Dr. Bonu, thank you very much. We had a question from Abu Bakr Muhammad Moki on how can the M&E profession be enhanced and evidence can be appreciated and used. And I think in all the responses we have heard so far, including yours, this is not a sprint. This has to be a marathon where you embed slowly into systems and you show its evidence and you build a cadre that works on monitoring and evaluation. So it's a building block by building block. Alison, very quickly, I'm going to go between the panel and back to Oscar and Alison. I hope Alison is still there. If not, Oscar can pick up the question. No, I see Alison there. Alison, someone is asking, and then a good question. It's Kudratullah Jahed, who's saying, how does GEI plan to include young evaluators' voices in GEI initiatives?
Thank you for that. And that's a great question. And this is an important constituency of the evaluation community that GEI is very determined to connect with. We already have a whole number of connections through our engagement with the training courses that we've been involved with a long time, IPDET, which has most recently, actually, in the context of COVID, engaged very actively with Eval Youth around evaluation hackathons, which have generated really interesting and very practical solutions to some of the really sort of thorny challenges of supporting evaluation in development. But we also engage with young evaluators through the CLEAR network, which is the network of centers for learning, evaluation and results. And those centers, which are situated in a number of regions around the world, already have networks around them which engage with young and emerging evaluators. But this is clearly something we want to do more of. We're excited about the prospect of building out our network. But I think in the end, the real magic to this comes from the mission for GEI to ground its work at the country level. And it's really building out those networks within country contexts, both networks linked to the government systems, but also outside through the private sector and civil society. That's where the spaces and opportunities, I think, for young evaluators in particular, will lie as we roll out over the next few years. Back to you, Junaid.
Thank you. Thank you. Dr. Shabnam Sarfaraz is a member of the Planning Commission. Welcome to this discussion. Dr. Sarfaraz, if I could ask you, how is the Planning Commission in Pakistan using M&E? And in particular, has the government been able to use formal evaluations and evidence in its fight against COVID-19? Dr. Sarfaraz?
Thank you so much. I'm glad that you framed the question as such. Post-March 2020, like everyone else, we too started working on war footing to identify the fallout impact of COVID-19. Mitigating measures were introduced to counter the untoward effects of the pandemic, besides strengthening our systems. However, throughout this time, there has been a conscious effort of retaining our focus on global goals, particularly on the vulnerable populations, be as inclusive as possible while keeping a close watch on the trends, measuring changes and capturing knowledge to guide better performance, ensuring transparency, which was vital, and staying on the track. Like everyone else, we too wanted to ensure that our gains in the past few years do not get eroded. At the Planning Commission, Government of Pakistan as member social sector, I'm leading the National COVID-19 Secretariat. My team was leading the sectoral responses. We reviewed, technically appraised, and approved the plans, agreed on the result-based monitoring frameworks, and are undertaking periodic reviews to oversee and monitor the implementation of these COVID-19 responsive plans. In the very beginning, we established the COVID-19 Secretariat, and it was a pivotal step that we took at the national level to serve as the conduit between the Planning Commission and the UN partners and other donors and development agencies for effectively coordinating their technical support. For a cross-sectoral socio-economic impact assessment, this Secretariat engaged with not only the development partners, but also the academia and research institutes, policy think tanks, both nationally and internationally. We are now engaging universities as centers of excellence in sectoral priorities. These arrangements are intended to optimize the existing expertise and align ourselves where the need is and taking responsive but focused and prompt actions. We are using evidence to guide us as we repurposed our existing funds, mobilized development partners' monies as loans and support, consulted and agreed on critical priorities, engaged sectoral experts. The performance management frameworks were developed for strategic top priority initiatives. The KPIs were highlighted, tracking their progress and reporting in publicly disseminated dashboards to bring in accountability. We are in the process of restructuring the evaluation processes and developing sustainable capacities for building the institutions in this critical area. Throughout this response planning, we have been conscious of the SDGs. Not only were they integrated into the annual sectoral reforms, but also studied to identify the reporting gaps for planning. We are working closely with the Pakistan Bureau of Statistics on dashboards for gender gap assessment, youth development indices at every district level. And I feel this collaboration and the expected results will be critical to inform targeted programs with clear goals and contributions towards the relevant SDGs. We did all of this being cognizant of the local gaps and recognized the need for strengthening our local M&E capacities. The underlying aim was to look at evaluations as a tool for transformative development and imparting the same understanding to our provincial governments as they develop their COVID-19 responsive programs and proposals. Indeed, COVID-19 has challenged the norms that we have been accustomed to. However, alongside it has provided an opportunity for a more equal Pakistan. We have been very conscious in building inclusive indicators into these result-based monitoring frameworks. I had witnessed the change. It's been my 5 years with the government, and I did see the appetite for evidence for guiding, programs and policies even before COVID. But now the need for robust evidence to guide planning is far more than it ever was. I would not say we have overcome the challenge, but we are definitely putting up a solid fight. It has indeed been a massive undertaking, ensuring that M&E is not forgotten in the well-intentioned rush to respond to our urgent needs. So shifting from just looking at budget utilization to monitoring and looking at the impacts and why we had invested these monies in, and making our reviews much more robust. So this is where we are heading towards. So I think I'll stop in here then.
Thank you very much. Montek Ahluwalia, who was a member of the old Planning Commission of India, when asked what was the future of planning commissions, he would immediately say independent evaluation institutes. That within government, you really need that kind of evaluation institutes. And what you're talking about in terms of being able to create that system and what Dr. Bonu talked about, I think speaks to that. Let me welcome Dr. Malika Samarnayake. Dr. Malika is the chairperson of the Institute for Participation, Interaction and Development, but was also the founder member and past president of the Community of Evaluators South Asia and Sri Lanka Evaluation Association. So a lot of experience and history in the whole profession of evaluation. Dr. Malika, if I could ask you, what role did evaluators play in confronting the monitoring and evaluation challenge in the context of Sri Lanka, and your thoughts about the challenges that we face in South Asia, given the experience that you have? Over to you, Dr. Malika.
Thank you, Dr. Joni. In my experience working in Sri Lanka and South Asian countries, some major challenges that undermine monitoring and evaluation efforts arose due to a number of factors. And one such thing is the highly centralized systems that we have to grapple with, which address the issue of budgetary allocation more than anything else. As such, monitoring is very much used as an instrument of financial control in project management by the central planning agencies. The sub-regional issues, unfortunately, do not receive the kind of attention that they should, because the regional issues are very specific to the regions themselves. So the centralized system itself is creating a big blockade for us in progressing in this area. Then yet another challenge that we need to face is downplaying the role of evaluation. The project funders very often lay emphasis on completion of project activities. Their interest diminishes once the project is over. Until then, the central level planning authorities also look at, okay, how much has been spent and how much has been allocated, what is the progress. It's that takes significant move. Often the outcome and impact of the project activities are overlooked process. Monitoring is downplayed when it comes to intended benefits and continuation of the impact on the community itself. Yet another is the inadequacy of data. I think the previous speakers also pointed out that in most organizations, data collection is either non-existent or missing a forceful strategy. There is no strategy as such. Therefore, what happens is they often focus on activity and output data, which usually do not align with the primary mission and vision of the organization. That's what I have felt. The lack of such information retards the assessment of the impact on the ultimate beneficiaries, very especially with regard to the community level beneficiaries. Of course, there are so many stakeholders down the line, but I'm thinking the ultimate beneficiaries on whom the impact has to be seen. Then another challenge that we are faced with is the inadequate emphasis on capacity building. I think some of the previous speakers also touched on that. There is a big gap between the supply and demand for evaluation professionals, particularly in South Asia. It is reflected by factors such as lack of experience, then the gaps in the technical knowledge itself, and the limited financial and staff resources. And as someone rightly pointed out, the young and emerging evaluators who are itching to find a place in society is often not recognized yet. They don't become partners of project management, sadly. But now we have networks, and we are trying to see in South Asia at least that how the young and emerging evaluators will gain their acceptance and be participatory in the project implementation itself. Building capacity in the field is therefore very essential, without which M&E as a discipline will remain underdeveloped, and accountability for government spending will not improve when this continues in this manner. The existing institutional facilities for capacity building of evaluators are inadequate at the moment, so we need to enhance this profession. Yet another challenge that we are facing as evaluators is lack of stakeholder voice in measuring social impact. Stakeholder voice, I'm underlining. The primary purpose of impact measurement is to promote a better outcome for the beneficiaries and participating stakeholders. Yet, the planning organizations are satisfied that the project has been completed when the budget is spent, whereas the feedback on the ultimate beneficiaries do not carry enough weight in terms of satisfaction. A system that consolidates the learnings from impact evaluation for moving towards the 2030 Sustainable Development Goal is yet to be realized. Yet another challenge is the use of participatory methods which are not appreciated, especially when the findings are negative. Because if you allow the people to speak, they speak what affects their lives. And it is not always the project implementers who are tuned to listen to them. An example from my experience, as an independent consultant, I was evaluating a project in the agriculture sector. When the critical findings were presented, a key position holder from the government condemned the participatory methodology as collecting gossip from the community. That's the level at which participation is looked at. At this point, fortunately for me, the funding agency who was present upheld the views of the independent evaluators and congratulate for steering through a participatory methodology where the ultimate beneficiaries could express themselves. So that was supportive to us. The traditional data collection methods, the truth may remain hidden due to the client and stakeholder biases. In this context, the exposure of key stakeholders and policymakers to the value of participatory methods is crucial, I would say. And yes, so these are some of the issues or challenges that we as evaluators are facing today. Then, in terms of what it will take to close the ME gap in South Asia and move to the next level, is another question posed to me. Effort should be made to make the collection and use of M&E data less threatening, more practical, more relevant to the intended beneficiaries of the development projects, I feel. Then plans should be made for improved implementation of evaluation, mainly by capacity building. One more minute. The intended project beneficiaries must play an active role in monitoring and evaluating project performance, and M&E gap can be reduced only by being transparent and accountable. These demand and supply side weaknesses need to be addressed before evaluation culture can progress to the next level. Thank you.
Thank you. I must say, Alison, as I listen to Malika ji, I really get a sense of this investment that we have to make in the capacity in the systems, in meeting the supply and demand, which is core to what the GEI is really focused on. So really, you really hear this loud and clear. Let me now introduce you to a fellow Bangladeshi. Very proud to have you here, Asif Saleh, who's the Executive Director of BRAC Bangladesh. For us growing up in Bangladesh, since the freedom, BRAC has been the organization that represents Bangladesh. You can't think of Bangladesh without thinking of BRAC, and you cannot think of Bangladesh BRAC without thinking of Abid Bhai, the founder of BRAC, an extraordinary human being and an extraordinary leader. And for any of you who have not been ever introduced to him, he has left us all, gone to eternal life. Please pick up a book and read about him. It's incredible what he has left as a gift for Bangladesh and the world. So I have to ask you, Asif, a question. Abid Bhai was a visionary. He thought ahead for all of us. Did he use evidence and policy monitoring to come up with his ideas, or did this come from the innate Abid Bhai that he was? You're muted.
Sorry, can you hear me now? Yeah?
There you go. We can hear you.
Okay. Sorry about that. Junaid bhai, first of all, thank you so much for the kind words about BRAC and also our founder. No, absolutely. I mean, he was extremely data-driven, and his ideas were very much grounded based on the problems. But then he constantly asked, after he came up with an intervention idea, that whether this actually worked or not. He continuously moved back and forth in terms of testing how the intervention is working out. And I think that probably is something that I wanted to talk about, just to make the discussion today a bit more grounded in terms of how we, BRAC as a whole, look at M&E and how we see that going forward as well, because it has played such an important role. Because for an organization that takes a lot of pride in the effectiveness of the intervention, it's very crucial that we actually put a lot of effort in M&E. And one example that we often give is that the groundbreaking role that BRAC played during in reducing child mortality in the early 80s. And if I can share the story, the answer will be obvious. I mean, back in the late 70s, it was clear that the majority of our children were dying out of dehydration due to diarrhea. And in absence of the availability of a market-based solution, a homegrown solution was invented. So it was half kg water, 1 fistful of sugar, and 1 pinch of salt mixed, created this homegrown oral rehydration solution. You would probably remember this, Junaid bhai, if you were in Dhaka at that time, that constant campaigning of Akmut Good, Akchimti Lawan, and Akachipani. And this, innovation was that this is something that BRAC said that we will go to every single household and teach mothers how to make this solution. So we first went to 30,000 households, trainers were sent, and the mothers were taught in terms of how to make this solution. So then we sent the monitors in, and we found out that only 6% of the mothers were actually using it. We were mystified. And then when the monitors asked the trainers what was going on, it seemed like that our healthcare workers themselves, let alone the mothers, they themselves did not believe this oral solution would actually work. So they were brought back, the healthcare workers were brought back to the lab. They were explained that scientifically how this whole thing worked. And then they were sent back again to 30,000 another household, 30,000 households. And then again, the testing was done, monitors were sent after the training. This time the number improved to 18%. We were mystified again. And then we sent a group of anthropologists to talk to the families at length. What was going on? Why were the mothers were not using the oral rehydration solution? And then it was turned out that our female healthcare workers were going and talking to the mothers and training them. In this entire process, the male members of the family were completely out of the loop. So when the decision time came in, so the male members didn't actually let the mothers engage or give that sort of the solution to the children. So then we started engaging again this sort of the men in the family, and that changed everything. So, you know, the efficacy rate of this went up to 80-90%, and eventually over a period of 5 years, we actually went to every single household, and coupled with the campaign that happened in radio and television, that the child mortality was heavily reduced. And so this is, again, just to give you an example of the sort of the monitoring, how crucial the monitoring is, particularly a scaled up innovation, that constant asking of the question that, is this working? And that's something that you would ask, is this working? And that's where the data comes in. And similarly, I think one of the things, if we look at the Abhijit was here, and evaluation, if we can talk a little bit about that. I mean, particularly in the context of ultra-poor graduation model that you may be familiar with, the 2-year intervention that is out there. That graduation program for extreme poor was started in Bangladesh in 2002. And then only with great success in graduation, but only after 4 years, when we started asking that, will this model work outside Bangladesh? And then as a group of actors, it's very much like GEI, came together, but in an ad hoc basis where, you know, JPAL came, or Ford Foundation came, BRAC came, and other implementers came. So we said that we're going to replicate this model in 6 countries. We're going to evaluate with an RCT model with Abhijit and Esther and see whether this actually works. And only when in 2015, after the completion of the program and the evaluation came out in the Science magazine by Abhijit and Esther, then, you know, the popularity or the sort of the acceptability of the model went up through the roof. And now this model is now being replicated in 46 countries in different contexts and stuff. It just goes to show how important also evaluation is for global advocacy as well. Now we have set up a separate initiative where we're working with governments to implement this model or the knowledge from this model into their social protection system. So I'll just kind of park here and then just hope that explained how important this is. So for the SDG and going forward as well, how crucial this will be for us as well.
Thank you very much. I think it was important to get a perspective from the spectrum of our panelists, some who are in government, some who are in civil society, some who are in professional bodies. All of you come at evaluation and monitoring with a common platform of its importance and its use. And I think this is a very important message for all of us to hear. Now we have about 25 minutes ahead of us and a lot of questions coming from the audience. So I'm going to do the following. I'm going to start asking these questions to all of you, but I'd like a quick response, if I may request that from you. So let me begin by asking Oscar. Oscar, a lot of people are asking, how do you convince policymakers that evidence and monitoring, evaluation evidence is important? I think there's a sense that somehow we're not being able to convince policymakers. What's your answer to that? Let's go very quickly to these to the answers.
As Dr. Bono said, we all want to succeed, but we want to have more impact. I mean, our policies need to be more impactful in improving the people's lives. And that's where the motivation, even for politicians, is to have more impact. And I would say if you give them the tools to do so with a system that adequately gives the checks and balances and allows citizens' participation into measuring that impact, then you can really have a good conversation with policymakers to use more evidence.
Dr. Bonu, same question to you. What's your perspective on that? How do you get policymakers more interested in evidence and making decision?
I think it is important to understand what the policymakers want. I think we live in different worlds. The world of real policy making and program implementation has its own constraints and compulsions. I think the most important is speed. I don't think the policymakers and program managers can wait for 1 year or 1.5 years. So we really need speed, and the cycle of collection of data, analysis, and useful insights has to be compressed. I think this is one of the biggest challenges for the global evaluation community or monitoring community, is how to use technology to reduce the gap between survey and the insights. Monitoring evaluation data on a transactional real-time basis to insights. I think there is huge amount of demand from the policymakers and others. It's about creating that enabling environment for them also. Another thing which I really want to emphasize is in last 10 years, huge amount of data is being collected by private sector, whether it's Google's of the world or Facebook's of the world, which is of very, very high quality, which is of great public good, So I think as a global community, we should also try to pull that data into for public and policy insights. Thank you.
Very, very, very important point. I think that we're learning that today, the traditional departments of statistics of governments are not able to deliver with speed and breadth the type of data we need in time. And that data is in many other places, in civil society, in private sector. How to mobilize that itself is a challenge. Shabnamji, if I could ask you, there's some question that's being asked. We're talking about national governments. In Pakistan is a federal country, as is India. What is your sense of M&E in local government, so provincial and local government? Is that important, and how are you addressing that in Pakistan?
Prior to working at the Planning Commission, I was with one of the provincial governments, and it was a large province of 110 million people. And I still remember the exciting moment when the Chief Secretary rang me up because the Secretary Health had complained that I'm delaying the research report, which he uses for identifying his priority districts for focused interventions. And I just couldn't believe it, He was waiting for the report to select the districts based on the evidence in that report, So we are seeing changes, and because they had been monitoring those, there was a whole complete system which was behind it. So when we provide them with the evidence which answers the question which is under discussion, I think that is the key. Sometimes we produce such beautiful, reports and volumes, but the policymakers, it's difficult for them to find out what is in there, which they actually require for their decision making. So I think these dashboards and these, which are based on these research studies, are very, very useful, and I've seen them being utilized extensively by the provinces. We are working on youth development indices, as I mentioned, gender parity indices, so that we can rank our districts. Under the provinces, we have, like in Punjab, we have 36 districts. So identify which are the priority districts for interventions and then monitor them, and establishing the baselines and then working towards them. And similarly are the SDG dashboards that we are trying to build upon. So I see these as exciting times because there's a lot of appetite, particularly after COVID-19. And this is an opportunity that we really have to exploit together.
Alison, I think the question to you would then be, how have you designed or thought of the global initiative working with subnational governments and with private sector and with civil society? Are all these stakeholders part of the effort that you're pulling together?
Absolutely, and that perfectly describes how wide-ranging we see the set of stakeholders that we want to engage with through GEI. And many of them are already with us, signing up as partners and associate partners of the initiative. I mean, one of the things I think what we're trying to do here, excuse me, is to build out an ecosystem around evaluation and evidence building. And that requires us not only focusing on the government system, but also looking to critical other partners at all levels to build and reinforce that engagement, excuse me, with evidence. Back to you. Back to you, Junaid.
Thank you. Malika ji, let me ask you, there's a very interesting question here. The question is asking us is in how evaluation associations can support government efforts, and in particular, evaluation professional associations. So I think this is something that's close to your heart. How would such associations help governments in the M&E process?
Okay, I think that's a very interesting question. And I have a lot of experience in this field where we have been struggling hard to convince the policymakers at the national level. So in SLEVA, Sri Lanka Evaluation Association, we used to have national level forums where we invite the key stakeholders in the government as the chief guest or someone who would like to listen to us. We were using it as a practice. So at one stage, at one of these national level conferences, we invited the minister in charge of planning and implementation as the chief guest. In the concluding remarks, after listening to us, he was actually throwing something at us, saying that, okay, if SLEVA is capable of assisting the government by formulating an M&E policy, it will be very helpful, he was saying. So he was throwing that back to us when we have been advocating. All right, if you think that is possible, tell us how to do it. This kicked off the SLEVA involvement in developing a policy document for the government in our country. Then a small committee was formed by SLEVA, which was burning the midnight lamp in trying to develop an acceptable policy for the government. And it was revised many times before we could submit it to the ministry. And the long and short of it is, it so happened that SLEVA tried to submit the policy document to the government, but could not draw the required attention due to change of personnel in the ministry. 3 times during our period, 3 times during my term of office, including a change of government itself during that time. This means it was like reinventing the wheel to please those who are at the head of administration. We have got to address them. Finally, SLEVA was able to draw the attention of the Department of Project Monitoring and Management under the Ministry of Plan Implementation on the need for a national policy on monitoring and evaluation. With the positive support from the initiative of this Department of Project Monitoring and Management, SLEVA could collaborate on further defining the M&E policy for the government, because we got a positive support from this particular department of the government. So we work together now that we have broken the trend somehow. So finally, the DPMM could convince the government in power for the adoption of an M&E policy, because they are part of the government itself, the implementing agency. As a result, the then Prime Minister was able to get the approval for the proposed national evaluation policy from the Cabinet of Ministers and launched it in the context of Eval Colombo 2018. We had a big conference making a milestone of the evaluation culture in Sri Lanka. So it's through Cabinet now. So that's a great effort that has borne results. As of present, it still has to go through the Parliament to become an act and to become law, having obtained required clearances from the legal draftsman. Credit goes to SLEVA for initiating action on the formulation of the policy document for the government. Yes. So now, at least we have gone up to that stage, even though it has not yet gone through Parliament. I hope during this new change of government will be able to push through this part of it, because now it has got cabinet approval. But cabinet approval is only policy. For us to go into action to take legal precautions, you have to have an act in parliament. So we are struggling with that. I would also like to look at the parliamentarian forum, which is existing in Sri Lanka. The Sri Lanka Parliamentarian Forum for Evaluation was launched in October 2016 by a group of like-minded parliamentarians and established it in 2017 to promote a culture of evaluation within the parliament. This is what I call an enabling environment. As a result, an evidence-based approach is used to formulate policies and laws contributing to achievement of sustainable development by 2030. We are on that path, even though we have not concretely come up with steps. It was established with the ultimate goal of promoting evaluation within Sri Lanka and to institutionalize evaluation within the parliament. All this time, we've wasted our time, sometimes I feel, trying to address the policymakers, but not the policymakers, I'm sorry, the decision makers at the government head departments like that, but never the policymakers. This is the first time ever we thought that we had to rope in the policymakers if this is to have an effect and also create an enabling environment. So the Parliamentarian Forum has taken the lead in establishing a parliamentarian committee on evaluation for passing a national evaluation bill and strengthening the Parliament research unit. They even have a research unit now. So that means we are depending on evidence. The draft bill has been prepared after obtaining stakeholder inputs in a guide way. The implementation of the national evaluation policy is a key prerequisite, I would say, for the successful operationalization of evaluation agenda in Sri Lanka. It vastly contributes to enhancing the enabling environment that we're all talking about for evaluation by raising the evaluation profile and leading to a more systematic cross-sectoral approach. It has to be a cross-sectoral approach, otherwise it doesn't work.
I agree with you. And I appreciate this, the fact that you're talking about influencing policymakers, putting a bill into parliament. Yes. That's putting a systems creating a systems. Yes. Asif, if I could pivot to you, many questions are coming from the audience talking about how do you include the local community, indigenous systems in the monitoring and evaluation. As I read these questions, there seems to be an implication that we're talking about an M&E system coming from the outside and not taking advantage of local knowledge and local systems. So inclusion may be at stake. Could you maybe share your thoughts about that?
Yeah, absolutely. I think it's and this is also, I think, important for GEI to keep in mind that it should not be just a one-way knowledge transfer. I mean, there are local knowledge systems that it can learn from. And again, I think going by what the speakers are saying, and at the same time, what we have learned, particularly during the COVID, at the peak in the middle of last year, that it was really important for us to be quick, and essentially that meant that normal traditional rule book did not apply, whether it's in evaluation, whether it's in intervention design, and government was coming up with policies which were just almost like building a plane as they were flying it. And the role of the government has also have increased post-COVID and during the recovery as well. So that means essentially we need to find a quicker way to evaluate this, and essentially not just evaluate, but I hope my examples showed that it's very important to learn from the evaluation so that we don't repeat the same mistakes. A lot of the policy prescriptions, some worked, some did not quite work. But we know that anecdotally, I don't know how institutionally that has been learned. So what I was saying that it's important that you don't put also all your eggs in one basket, which is the national government. It's because there are a lot of other actors. you identifying actors who can influence the government and working with them, building capacities within institutions. I'm very heartened to hear that that's there. That is absolutely important, and also an individual capacity is also very important. And working with local actors, working with local partners whom also GEI can learn from, because we also have applied creative methods so that we can tap into this various sort of ecosystem within this sector, and we have to be very creative. The other opportunity I would say is also, I think another discussant mentioned is that, and similarly also players like ours who operate at scale is seeing with this data collection. Essentially, Abhijit Banerjee talked about lack of data, but there are also a lot of data spread across in different systems, whether it's in, if I talk about Bangladesh, whether it's in BRAC system, whether it's in different ministries in the government. It's just nobody is not putting them all together and making sense out of that. So I think that's very, very important. I mean, our healthcare workers are going door to door and collecting the data. Now we are supporting the government to ensure that who are the high risk, so to get the vaccination, because we have access to the data with that we are collecting every month for a long time. And because of technology now, it's easily also mineable data as well. So that's, I think an important area. So rapid evaluation, looking at local systems, real-time data analysis and monitoring. I think that's an area where because of the speed that is required in various systems now more than ever, and then we have the technology and the ability to do that. So how do we also do rapid data analysis and real-time data analysis to improve our efficacy of the program? Because oftentimes, whether it's the government projects or international development programs, by the time the evaluation results come in, already it's far too late, because the next intervention has already been designed, next project proposal has already been done, and the second project has already started. So we didn't actually learn from it, and context is changing very rapidly everywhere. So I think that's another area to look out for. So as you are planning on the capacity developments, those are the areas where we are lacking capacity. And one thing that comes in all the time as well is that reducing the cost of evaluation as well. So how do we also become creative through these partners in national systems to reduce the cost of evaluation so that it actually doesn't seem like a lot of money when you actually are thinking about it? Thank you.
You know, these are very wise words. One thing that I do take away from what many of you are saying is we also can't put all our eggs into one methodology, right? And this is something that with Abhijit we often talk. RCT cannot be the only methodology. That when we're talking about monitoring and evaluation, it has to be a spectrum of methodology, some that has to have a rapid response, some that has to be able to go into local contact, and some that can have a longer perspective. So I think the ability to do that. Oscar, I see you nodding on that one. Your thoughts on that, please.
Yes, indeed. We need to have an approach based on mixed methods, and it depends on the evaluation question. What do you want to respond? That will determine what is the best methodology. And we are very happy to really be surrounded by a cadre of the best evaluators around the globe. And that is what the GEI is offering, not only from the CLEAR centers, but also from IPDET and from other partners, from Better Evaluation and the bilaterals who are among us. And I would like to recognize the contribution of Sweden, Germany, Norway, Netherlands, Finland, Denmark, Canada, Switzerland, New Zealand in many of these initiatives, and we hope that together, we also with other UN agencies and regional development banks, we would be able to do a good assessment of the situation in each country and provide what is needed in that particular situation. And I'm very happy to be launching this initiative in South Asia that looks so promising based on the good examples of institutions that have been working for so long in this area. Thank you.
So I take away from both Alison and yourself, Oscar, that GEI is purposely done flexibly to be able to create partnerships with civil society, governments at different levels, of the system in a federal system, for example, with local governments, city governments, and very much one that will draw on local knowledge systems. Alison, am I summarizing this correctly?
Absolutely, Junaid, that's spot on. And really what GEI is trying to provide is, as I said at the outset, this platform where we can link together practitioners and experienced professionals in this space with those purveyors of kind of local experience and local knowledge to really support what they're able to do, scale it, and make a bigger impact on closing this evidence gap. And I think there's no intention at all from GEI to, in a sense, propose kind of global solutions to these problems. These are fundamentally challenges rooted in specific contexts. There are many different ways we can frame this gap in monitoring and evaluation capacity, but we really see an enormous opportunity for GEI to motivate and build momentum and really to sort of bring evaluation and monitoring into the 21st century for so many countries. And, you know, just reflecting on Asif, who said it so beautifully around the importance of kind of locally embedded approaches. I mean, as someone who's kind of been around the evaluation community for a while, creativity and timeliness and evaluation are not often said in the same sentence. And I think really what we're trying to do here is to provide huge amounts of experience and knowledge to really generate that creativity and timeliness to make it all relevant for doing better and more effective public policy.
Well, ladies and gentlemen, I want to thank all of you for participating in this discussion. I'm going to ask the organizers to put in the chat and Twitter the address where they can you can send some of the questions, because we have not been able to at all do justice to the rich set of questions. But if I may, there's some takeaways that I think for me are very important. Number one, I really appreciate that all of the panelists here have not talked about monitoring and evaluation as a technocratic issue. It is a process issue at the heart of policy making. There's a political economy here that needs to be dealt with if monitoring and evaluation and data are going to matter in policy making. If we think of it only as a technocratic issue, we're not going to be able to address it. I also very much appreciate that all of you have talked about building national systems and therefore embedding capacity into it. But capacity will require partnerships. And partnerships, whether it's with NGOs, whether it's with associations, and importantly, partnerships with government. Because ultimately, we know that to scale things up, there are two fundamental players that you have to influence. You either influence the market to scale things up, or you influence government to scale things up. You cannot scale things up outside either of them. So I must tell you, I had that discussion with Abid Bhai, trying to convince him that BRAC couldn't scale up, and I stand gladly, completely corrected. Boy, if there was an organization that scaled up, that was BRAC. But I think this issue of influencing government and policy making is at the heart of what we do. Just to let you know that one of the big platforms that we're working on in the World Bank in India is to invest in the statistics architecture of the country. Because if you cannot invest and improve the data systems, you're not going to be able to feed into an open, transparent dialogue in society. And I think that's a very important element. Alison and Oscar, one big message coming out of the chats are inclusion is very important. There are countries like Somalia that may not be in the family of systems, and there are people, tribal groups, gender that may not be in the system, that our monitoring and evaluation system must include. And I think that's a great message to end with. So ladies and gentlemen, thank you very much for participating. To our panelists, thank you for making this a very exciting and rich conversation. I wish you all the very best, and please be safe wherever you are. Thank you very much for joining us.
Thank you very much.
Thank you.
Thank you. Thank you.
Thank you so much.